Sometimes a wound just simply isn't suitable for closing. It could be because it's too deep and it's got these, if we bring the edges together, it closes pockets of air where bacteria is rife and is going to grow and create infection. It could be that during the examination process we're concerned about underlying structural damage to structures such as tendons, ligaments, nerves, blood vessels, etc. So what we have to do is still maintain the cleanliness of the wound to prevent infection, whilst arranging for them to go off the ship and be seen ashore by a specialist. So in our kit we have this stuff called paraffin gauze that we can use to do that. So at Red Square Medical, ours comes in packs of 10. Yours may well be individually packed on board. So what we're going to do is just going to peel it open, and what you'll find inside these packs of 10 is that they are sandwiched in between bits of hard plastic. So I'm just going to peel back one of those hard bits of plastic and expose one of these pieces. So I'll just get it out to show you. So with paraffin gauze, when we're using it for wounds that are too deep and possible underlying structural damage, we use it to pack the wound out, to fill all those little gaps and crevices. So what we're going to do is just gently open the wound up, and we're going to pop paraffin gauze in until it's filled all those little crevices. You may need to use more than one piece, so please just use as much as you need. And what you'll find is that towards the end it's just poking out of the top slightly. That's perfectly normal, and that's exactly what we'd expect to see. So once you've done that, the next thing to do is get out one of your NA non-adherent dressings. Remember, these ones have got a shiny side and a non-shiny side, and the shiny side is going to go down over the top of the packing. We'll just get a little bit more here, and we're just going to lay it across like that, and then tape it all down to finish it off. Now what's going to happen is, if we can't get them off straight away, every 24 hours at least, we're going to take all of this dressing down, we're going to remove all the packing, and we're going to examine the wound to ensure that it's still perfectly clean inside. If it's not, then we've got an opportunity to give it another clean, and then we're going to repack it with fresh packing, put a fresh dressing over the top, and then continue to monitor it at regular intervals. The other way that we can use our paraffin gauze is if we have a nasty abrasion to the skin. So think someone's fallen off their bicycle, scuffed across the road, they've got a really nasty gravel rash, you've cleaned it all out, plucked all the bits of gravel and dirt out of the wound, and now you want to protect it. And we know that these wounds leak fluid. So what we don't want to do is have them sticking to everything they come into contact with. So with the paraffin gauze, you're just going to lay it gently and smooth it across the extent of all of the abrasion. Once you've then done that, you're going to get one of your non-adhesive dressings, and you're going to cover up the extent of the wound. You can just about see that's covering it, and then, as before, just tape down on all the sides. And what this will do is it will still allow fluid to leak out of the wound, which needs to happen, and the non-adhesive dressing will collect that and absorb it. And what will happen is the paraffin gauze will help promote wound healing, but will also prevent all those fluids from actually getting stuck to whatever it is that you're wearing, or that the patient is wearing, and creating loads of problems that way.